ask you to take your seats. So good morning, everyone. My name is Altaf Station-Walla, and I'm President and CEO of Mackenzie Health. Thank you to everyone for joining us today here on the traditional territory of the Mississaugas of New Credit First Nation. I'd like to welcome our government and project partners in the room. We're today in the Cortellucci Vaughan Hospital, an amazing day. It's bright, it's sunny. Hopefully you can see how amazing this space is. Unfortunately, because of the pandemic, we're not able to have everybody in person here to celebrate, but there are thousands of staff and community members who are live streaming this event from work and from home. I'd also like to welcome MPP Daisy Way and MPP Michael Parsa. Thank you for joining us. This morning, you'll hear from our board chair, Minister of Health, local MPPs, project partners, the Mayor of Vaughan, who is also the chair of our Ultimate Care campaign. We'll take some group photos at the end of the event, and we're asking everybody to obviously follow formal social distancing. So we'll be very careful. We ask you to adhere to the staff that will ensure that we take these pictures appropriately. So we're here today, and what an amazing moment this is. I want to take a few moments and thank all of the staff and our partners who've gotten us here today. We have worked so hard to get to this point. The building is now substantially complete. We have the keys to this hospital. Now, when I reflect upon the last 10 years of our journey to get here, we've had many events on this site, from a groundbreaking to sign unveilings, to the actual start of construction, to a topping off ceremony just a few years ago. But this is just a surreal moment to be actually standing in a complete hospital. And we would not have achieved this milestone without so many people helping us get there. The expertise of so many of our staff at Mackenzie Health, the collaborative effort of our external partners, including our project consortium, architects, project consultants, vendors, and most importantly, government. Over the past few months, many of our staff have had multiple jobs while we got here. We've been battling a thing called the pandemic, and they have been doing yeoman's work to do both the work that it takes to get this hospital ready and also ensure that we continue to provide frontline care in this very challenging time. I want to thank all of our staff for finding a way to get through this and keep this project going. Cortellucci Vaughan Hospital will be the first net new hospital in Ontario in more than 30 years, and we can't wait to open our doors to full capacity. When we open our doors early next year, this new hospital will help alleviate capacity challenges not only for Mackenzie Health, but for many other neighboring GTA hospitals, and most importantly, it will alleviate pressures for the entire healthcare system. And although the building may look complete as you look at it, there is still so much work that we need to do. Over the next few months, our staff will work tirelessly to turn this building into a fully functioning hospital, and we'll likely have to do it while we're battling a second wave of the COVID pandemic. Between now and opening day, our teams will need to install and test over 30,000 pieces of equipment and technology. We'll have to train over 3,000 staff, and we'll have to ensure that we can provide safe, high-quality day to our community on day one. Now, some of this work includes doing mock patient scenarios so we can test all of our practices and our procedures, completing deficiency work in the building, preparing our retail spaces, and installing donor signage. We know how excited this community is for this new hospital, and we are too. We look forward to opening early 2021 and doubling our community's access to the ultimate in care. Now, I'd like to introduce our first speaker, Mr. Mark Falbo. He's our board chair, and he has been with us for almost 11 years, I think, Mark. He has seen this project from its inception, your tireless leadership, your efforts in advocacy with government and with all of our stakeholders. Mark has enabled us to get here today. and your continued support in leading our efforts as a board and as an organization does not go unnoticed. So Mark, I thank you for everything you've done, and I would ask you to come to the podium.
Good morning, all. Thank you for that kind introduction, Altaf. As we can all imagine, and indeed know, building a hospital is a true testament to human effort, perseverance, innovation, and community spirit. It takes thousands of people, literally millions of hours, years of hard work and preparation, from planning to design to construction to the heavy operational readiness planning activities that Altaf mentioned to get this hospital ready to treat patients in our community. I lead a global technology company here in Vaughan. I've been a resident for almost 4 decades, and as Altaf mentioned, I've been on the board for greater than 10 years. So I know personally how much this community needs this hospital. When it opens early next year, Cortellucci Vaughan Hospital will be the first hospital in Vaughan, the first smart hospital in Canada, and the first net new hospital in the province of Ontario in greater than 30 years. We're here today in a beautiful state-of-the-art building, but we all know that a hospital is more than a building. It's an integral part of our community. It's the staff, nurses, and physicians who come to work each day committed to improving the lives of the patients they serve. It's the volunteers who give of their time to help make the patient and visitor experience a very positive one. It's the government partners at all levels, municipal, regional, and provincial, with their unwavering commitment to this project and the provision of the funding necessary to make it happen. And it's the donors who contribute their hard-earned dollars to help make hospitals like this a reality. We're in the midst of the largest community hospital fundraising campaign in Canadian history. We are proudly more than 2/3 of the way towards our $250 million local share needed to build and equip Cortellucci Vaughan Hospital and enhance care at Richmond Hill. We're currently standing in the Cortellucci Vaughan Hospital in the Muzzo de Gasperis Tower, in the Vic Dezen Family Welcome Center, next to the Magna Emergency Department and the de Gasperis Cone Learning Center. These are all wonderful, amazing examples of incredible generosity from families, business, and the community to help support our goals. As you drive by Major Mackenzie Drive, and once you have the chance to walk these incredible halls when we open, you're going to see the names of all the donors that have helped support this cause. I reiterate that it takes thousands of people and millions of hours to turn these walls into a hospital that can serve patients. I'm very excited now to introduce a video featuring some of those people that helped us achieve this incredible milestone today. And they're going to tell us in their own words what this means to them personally.
Reaching this substantial completion milestone is the result of the culmination of years of hard work of several thousands of people. Every aspect of this facility site is carefully considered and scrutinized.
It is as this milestone that we are able to see the results of that hard work by all of those individuals who in some way have contributed to this great facility.
Reaching substantial completion at the new CVH hospital means we've delivered close to 30,000 pieces of furniture and equipment, many of which are integrated to optimize smart clinical workflows and provide the highest quality patient care.
The smart hospital brings new technologies together to automate clinical workflows and to improve patient safety and their experience of care. We are all super excited that the smart hospital vision becomes a reality.
I can't imagine anything feels better than completing a major hospital project during these very trying times. What does substantial completion feel like? It feels like being part of the track team and running your heart out and passing the baton to the final stretch to opening day.
It is wonderful to finally be on the other side of this long journey. Undoubtedly, a key factor in our success is attributable to the many uniquely talented staff who have worked tirelessly to address every painstaking detail. We hope you are delighted and amazed by this remarkable facility.
As you can imagine, building the first new hospital in York Region in over a generation involves a lot of work from a lot of people representing various trades. Over 3 million labor hours were put into this project. We look forward to seeing how the new Cortellucci Vaughan Hospital will continue to shape healthcare in the province.
Reflecting on the last 4 years of experience with the MH and the PCL team. I'm proud to turn over the facility and proud of our team and MH's team. And I look forward to MH making this facility into a hospital.
This is a very important milestone we've just reached here at the Cortellucci Vaughan Hospital. The hospital is substantially completed. As chair of the Ultimate Campaign, we need to raise $250 million. We have now raised $178. I need your help to take it home.
I want to thank the thousands of individuals involved in this project called the Cortellucci Vaughan Hospital. We've achieved a significant milestone, substantial completion. We could not have done it without your support, without your contribution, and your hours and hours of effort. We thank you for everything you've done to make this project a reality and in helping us get to this amazing milestone. We are just months away from opening this hospital, and it would not be a reality without your efforts. Thank you so much.
Well done. Ladies and gentlemen, distinguished guests, ALTAF, the entire staff, and all those live streaming today, on behalf of the board, I can say with all sincerity, we would not be here today but for the incredible support of our community and all those staff and partners who worked so hard to achieve the substantial completion milestone today. We're confident that with the community behind us, we're going to get the rest of the way there and look forward to a great opening early in 2021. And so with sincere admiration and appreciation, thank you for joining us on this milestone event this morning. Thank you.
So thank you so much, Mark. It's obviously clear that we can understand how far we've come from that video and all the milestones that we reached to celebrate today. I'd next like to invite Deputy Premier and Minister of Health, the Honourable Christine Elliott, to come to the podium to say a few words. Now, Minister Elliott is not a stranger here at Mackenzie Health. She has toured, I think, the site at least 3 or 4 times and has seen the progress over the last number of years. You've seen clearly how hard we've working and how effective we've been at ensuring that we can actually open this hospital on time, on schedule, and on budget. We're so appreciative of your support, Minister Elliott, and I know that your ministry has been sort of there all the way along the path to get us to this amazing point. So I'd like to thank all the staff within the Ministry of Health as well. And I know that we met probably as early as 2012 at Queen's Park, and we started to talk about the need for additional healthcare in this region, in Vaughan, and the importance of this new hospital. So I thank you for those early discussions, for your continued guidance and support, and we hope to celebrate a lot more milestones with you in the near future. So, Minister Elliott, please come to the podium.
Well, thank you very much, Alta, for your very kind introduction, and good morning, everyone. It really is an honor and a pleasure to join you here today for this very important milestone, something I know that's very significant to each and every one of you for your own reasons. It's also great to be here with my colleagues, Stephen Lecce, the Minister of Education and MPP for King Vaughan, Michael Tabolo, the Associate Minister for Mental Health and Addiction and MPP for Vaughan Woodbridge, Daisy Y, our great MPP for Richmond Hill, and my colleague Michael Parsa, with whom I share Aurora as representative, the MPP for Aurora, Oak Ridges, and Richmond Hill. Thank you, everyone, for being here today. But I do want to start by thanking the staff and leadership at Mackenzie Health for your incredible and ongoing efforts in the face of COVID-19. These are unprecedented times for all of us. But when this virus swept across the world, all of your staff, all of your doctors, nurses, personal support workers, and all the other healthcare workers really showed us the depth of their compassion and their commitment to keeping all of us protected and safe. So I do want to extend my deepest appreciation to everyone, the staff, the doctors, the nurses, everyone in the hospital, the volunteers, and of course the donors for causing this facility to be here. So thank you very, very much for that. So today, with my colleagues from Queen's Park, I am really honored to celebrate the substantial completion of the Cortellucci Vaughan Hospital. As has been noted, the first net new hospital built in Ontario in more than 30 years. This significant milestone means we are another step closer to opening this state-of-the-art hospital early next year and will directly help build more capacity in the health system, shorten wait times, and end hallway health care in Vaughan, King, Richmond Hill, and across York Region. Once complete, the new Cortellucci Vaughan Hospital will have the capacity to add up to 350 inpatient beds in the community, with 90% of those beds in private rooms, giving patients and families more privacy and, given what's going on today, more infection prevention and control measures. Some of the exciting features, and there are many as you can see, but some of the exciting features of this new hospital include fully integrated smart technology systems and medical devices that have the capability to provide real-time information to help enhance the patient experience. The patients who pass through these doors are also going to benefit from modern surgical services and operating rooms, advanced diagnostic imaging, specialized ambulatory clinics, intensive care beds, and access to mental health programs and services. I want to congratulate the hospital's executive team and staff, the community and its leaders, and everyone who has come together to make this spectacular project a reality. Our government is also incredibly proud to be able to support this important hospital infrastructure project. As part of our plan to end hallway health care, we are making infrastructure investments in communities with high growth needs based on robust data relating to where demand for new services will occur. Communities just like this one. So thank you very much for the invitation to join you for this important milestone. I've been honored to join you for other visits, but this one is really spectacular. So thank you. And together I know that we are going to be able to provide excellent quality patient care here and across York Region. And I certainly look forward and hope I will get an invitation to the opening day of the new Cortellucci Vaughan Hospital. So congratulations to all of you. Thank you.
Thank you, Minister, for those kind remarks and your ongoing support. I'd now like to invite our local MPP for King Vaughan, Stephen Lecce, to provide some remarks. And not only is MPP Lecce representing the riding that we're in today, but he's also the Minister of Education. And his support over the last number of years has enabled us to get to this amazing milestone. So Stephen, we thank you for the daily and almost weekly calls that we have to push this agenda forward to ensure this hospital is built on time, and more importantly, to also ensure that we have the funding that's necessary to open the doors to full capacity. So Stephen, we thank you for everything you've done, and please come to the podium.
Well, thank you. Good morning, everyone, and thank you very much, Altaf, for that kind introduction. It's good to be with my colleagues, with Minister Tivolo, with MPP Way, as well as MPP Parson, of course, the Deputy Premier and the Minister of Health, who has been an enthusiastic supporter of this project from the very beginning and who's been here quite often. So we do like our quarterly hellos for Minister Elliott back at Mackenzie Health, because we've been here, I think, on a monthly basis at this point. But we obviously appreciate so much the progress being done. And Mayor, good to see you, sir, Chair Falbo, and everyone who's with us. We're really grateful for the unity of spirit. I think what we've seen in the city of Vaughan over the past months as we deal with COVID-19 is a great unity of spirit that has come among us. Challenges as we face COVID-19, but our community, our business community, everyday people, young people and seniors, all of us have stepped up in a really profound way to give back and to support those in need. And then that's the history of our province as we respond to COVID. And this hospital is so brilliantly timed to provide the capacity we will need to counter COVID-19, to reduce hallway medicine, and ultimately to improve the quality of life of a fast-growing community. And the residents of this community have waited many years, are in desperate need for this investment, and I think they, today, are the greatest recipient of this success. They deserve this, and the people of Vaughan, I think, who have paid their way, waited patiently, I know will benefit from this hospital that's going to make a massive difference in how we deliver healthcare from a technological perspective, as well as how we deliver care. Patient-centric care, which is at the heart of what the government is trying to deliver for the people of this province. I also just want to recognize the women and men who have worked so courageously through this pandemic at Mackenzie and all of our frontline staff. These are the women and men who I think really we honor today, because they'll be serving here and committing themselves to the care of our residents and our patients. And so for those watching, I just want to join my colleagues in saying thank you for all that you have done and you continue to do to help us get through the worst of this pandemic. The services added here at Mackenzie are unique. I think these differentiators will make a difference. I particularly think of the Women and Child Program and likewise medicine surgery. This will be a full service emergency department. I mean, all of these things will allow families in our community to stay in our community, to access the care they deserve right here in the city of Vaughan, serving families in Richmond Hill, in Aurora, in King, and right across York Region. So we just express gratitude to everyone who's been part of it, to the 1,000 women and men who helped build this place right through the pandemic, also sacrificing. We say thank you. We are very proud of this success, and we look forward to opening it in short order. Have a great day. Thank you all.
Thank you so much, MPP Lecce, for those kind words and for your ongoing support. Our next speaker is the MPP for the neighbour riding of Vaughan Woodbridge, Michael Tobolo. MPP Tobolo is also the Associate Minister of Mental Health and Addictions. And Michael, we've had many great discussions around the need for continued investment in mental health and addiction services in this region as well. So we thank you for your support as well around this hospital project and the funding that's required, and also our ongoing discussions around the future investments with mental health and addictions. So Michael, please come to the podium.
Thank you, Altaf, and it's great to be here as well at Mackenzie Health to say a few words and really to congratulate the entire team on the incredible effort of putting the hospital together and giving us this incredible opportunity. Just across the street is Vaughan Woodbridge, and there's 250,000, 300,000 people there that will be looking to this hospital for support, for over 400,000 people around the region. So it's an incredible asset for us to have in our backyards, and we all know that the best services are always the ones that are offered closest to our homes. You know, when I reflect on the change of this, the area, you know, an empty field to a big hole to the walls starting to come up and the shell being closed, and, you know, to today where we're in here without construction boots and vests, to a place that is going to be critical to the lives of so many people. It reminds me of dreams. It reminds me of looking at wanting to do something, but a dream can't become a reality without motivation, and the motivation of your board for having come together and worked so hard, the government for having done so much from the standpoint of supporting that dream, and of course all the donors that have put millions of dollars into the building as well. The hard work of our mayor, who's done an incredible job heading up the foundation as well to get us where we are. You know, these are all the elements that come together, but we have to remember, as was mentioned by Minister Lecce, that the life of this hospital will be the people that will be working here. Over 3,000 people. These are jobs that are coming into the community, but more importantly, they're people with vocation that are looking to help other people, and that is so, so important. Through the COVID-19 pandemic, we've seen the workers of the front line and the hospitals doing everything they could do and putting their own lives at risk to ensure that people were safe and kept safe. And that continues. And again, I reiterate what was said earlier by the ministers. This is really important that we recognize and thank the frontline workers, the ones that were working the two jobs, the ones that were doing their jobs and then dealing with what was happening here. But we're at the point of substantial completion, and that's an important point. However, now we've got to breathe the life into the hospital, and that's bringing the 3,000 people in here and working to turn this into a living, breathing organism, and we're almost there. So I want to congratulate all of you for the hard work in putting this together. I am so proud to represent Vaughan Woodbridge, as I'm sure all my colleagues are throughout York Region. And we all look forward to coming back, along with Minister Elliott, hopefully, to be here for the opening of the hospital. So again, thank you, Altaf, Mark, for the great work that you've done as well. The great work that all the construction companies did coming together, and it was almost like a symphony in here, how you all brought it together. So thank you all for the great work. Thank you.
So MPP Tobolo, thank you for those kind remarks and the passion around the real sort of effort, which is to really make this hospital alive, and the staff that has to actually make it happen. So we're so excited the day that we will actually deliver care in this facility. And I have to tell you, Michael, I'm a resident of Woodbridge for the last 17 years, so it's great to have you as our local MPP. Now, we wouldn't be here without some other key players, and we have a very unique model in Ontario with an entity called Infrastructure Ontario. And we know that sort of infrastructure projects are complex. They don't happen often. The expertise, for example, in a hospital, it's a once-in-a-lifetime sort of effort. So to have sort of a sounding board like Infrastructure Ontario that provides guidance, that provides advice, and that provides leadership to ensure that we deliver projects on time, on budget, and we provide great value to the residents of Ontario, I think we're very fortunate to have an entity like Infrastructure Ontario. So I'd like to invite Michael Lindsay from Infrastructure Ontario to talk a little bit about the role that they played and the contribution you've made. So Michael?
Thank you, Altaf, and good morning, everybody. On behalf of Infrastructure Ontario, I am ecstatic to be here to celebrate the incredible achievement that is the Cortellucci Vaughan Hospital. This is the first smart hospital project that we've helped deliver, and we're very, very proud to be helping to meet the needs of communities in York Region and the city of Vaughan. This project, as Altaf has said, would not have been possible without incredible collaboration and the genuine partnership that grew between IO, Mackenzie Health, PCL, and Plenary. Way back in 2014, when we first did the request for qualifications, through to the RFP, the request for proposals in 2015, to the contract award, the groundbreaking ceremony in the fall of 2016, and now through to substantial completion, this project has been on schedule, despite a few setbacks. And that wouldn't have been possible without that genuine partnership. And I'm not the first to say it this morning, but I want to amplify the point. The completion of this project in the teeth of the COVID-19 pandemic is an incredible achievement. And to have no impacts to the project schedule is really quite remarkable. It allows me to say those magic words that we always like to say at the end of our projects. This was done right, it was on time, it was on budget, and all the scope is completed. In partnership with owners in the private sector, we like to think that our ability to deliver projects while driving schedules gives decision makers the certainty that they need to stand behind these investments, which are worth hundreds of millions of dollars. But having a new state-of-the-art smart hospital in the York region is certainly much more than having a shiny new building. This facility is going to transform the healthcare experience and quality of care for residents, filling a much-needed infrastructure deficit in this region and benefiting this community for generations to come. I also wanted to highlight that this project opened up a considerable amount of jobs, both directly and indirectly. At the peak of construction, PCL had over 900 workers on site each day. There were over 3 million labor hours worked by PCL on this project, and I have to tell you, it is remarkable that that was achieved without a single lost time injury. That's an extraordinary feat. And to coordinate that many workers and to maintain productivity and safety on a busy construction site deserves a hearty congratulations to everybody involved. This project marks our 49th P3 hospital project to reach substantial completion, and we couldn't be more proud. We take great pride, and we think we're very privileged to be able to deliver these important facilities to the people of Ontario, and we're very, very proud of our strong track record when it comes to delivering these complex projects. I'd like to thank our IO team, Angelo Gismondi, Guy Logan, Rachel Brown, who were instrumental to this project. Thank you to Altaf and the team at Mackenzie Health. You are incredible partners to work with. Thank you to Albert Iwasaki, Hafiz Habib, Frieder Aldinger, the phenomenal work from Plenary. Thank you to Kelly Wallace, Andre Bowen, Randy Steffen, everybody at PCL for providing a safe workplace and for finishing this project on time. And thank you to Johnson Controls for their commitment to maintaining the hospital for the next 30 years. IO is committed to delivering value to the people and communities of Ontario, and next year when this hospital opens, the fast-growing community of Vaughan will have the healthcare that they genuinely deserve. My thanks very much for the opportunity to be here today.
So thank you so much, Michael, and thanks to the entire team at IO for their ongoing support and guidance through this effort from, I think, 2013 when you first got involved. So you've mentioned, Michael, that the project consortium obviously has a huge role to play in this, and obviously our partners at Plenary, PCL, and JCI are instrumental in making this facility sort of what it is today. You can see just how spectacular it is. And what's important to me is just the quality of that build. So our clinicians that are walking the floors as we speak are just overwhelmed. It's actually delivered exactly the way we intended. And that is not a small feat. Those of you that have even done small renovations in your home know it never turns out the way you anticipate it will. But I can tell you more often than not, we've hit the mark. And we've hit that mark because of the partnership, I think, that exists with our consortium. It is obviously a contractual arrangement, but I think we took it to another level. We absolutely agreed that we needed to work together and we needed to problem solve. I'm going to ask Kelly Wallace from PCL Construction Canada to come up to represent the consortium. But Kelly, I want to say a couple of things. At the height of the pandemic, I think maybe it was March 11th or something like that, we had this hard discussion as to whether we would keep this site going. And we had workers that were absolutely in the front line, no different than healthcare workers who were afraid for their lives. And we found a way with our IPAC team, with some of the efforts of the government to enable the project to go 24 hours a day. So that really did help for that physical distancing. And we found a way to keep this thing going and hit the mark and actually hit the SC date that we talked about. So Kelly, thank you for your leadership from PCL and the entire group from Plenary, because we are here because of our ability to work together. So Kelly, please come to the podium.
Thank you, Altaf, for those kind words, for the introduction, and for the opportunity to take part in this very special day. Your words are definitely humbling. On behalf of the Plenary Health team, it is a pleasure to be here to celebrate substantial completion of the Cortellucci Vaughan Hospital. We officially achieved substantial completion the morning of August 26th, 2020, which is a great milestone for the entire team. This project is a tremendous example of the power of collaboration, and we take pride in sharing this milestone with a very talented team. The successful outcome we're celebrating today was made possible thanks to the passionate pursuit of a shared vision instituted by Mackenzie Health and embraced by all project partners. Alignment in this vision is what motivated us to overcome any challenge, and I believe it speaks to the relationship built between Mackenzie Health, Infrastructure Ontario, Plenary, PCL, JCI, our valued consultants, subcontractors, and our suppliers. This is truly an exemplary piece of infrastructure, from the integration of advanced technology to the incorporation of sustainable and innovative building techniques, including the modular construction of over 300 patient washrooms. This hospital will set a new bar for health facilities. And while we are extremely proud of the build, none of our projects are successful unless everybody goes home safely every day. I'd like to recognize nearly 80 PCLers who worked on this project from pursuit to completion under the leadership of Andre Bourne and Randy Steffen. The team's commitment to safety influenced the over 1,000 women and men whose hands built this project day by day. Not only were these women and men committed to quality craftsmanship, they enabled us to overcome the odds and complete the hospital for the community during a global pandemic, with over 3 million hours worked without a lost time injury. In our business, that's a really impressive stat. I know they can't be with us today, but I would like to thank every person who stepped foot on this construction site for making it your personal responsibility to work safe and return home to your families and loved ones at the end of each day. This was made even more complicated during the pandemic and these unprecedented times. I would also like to thank the representatives of the province of Ontario, Altaf, the members of your board, and senior leadership team for selecting us to build your vision for the Cortellucci Vaughan Hospital. We hope that we've done you proud. Thank you very much.
So Kelly, you have, and we thank you for your support, because this is an amazing facility, and I think people from around the world will come to tour to see what we've achieved here. So thank you again for your leadership. Our final speaker needs no introduction. He's the mayor of Vaughan since 2010. And for the last few years, he's led our amazing campaign, the Ultimate Campaign, to raise $250 million. And as you know, we've raised $178 million against that target. And Mauricio, I know we started around the same time. I think you came into office in 2010. I started as CEO in 2010. You came on our board in 2010. And I think the biggest challenge we both had was how to say each other's names. So Beva Lacroix, Station Walla. I think it's almost the same number of syllables. But Mr. Mayor, you've been an amazing support, from being on the board to leading the capital campaign to providing ongoing guidance to also being a contributor to the lands that this project is built on. So we thank you for your support, and we would ask you to come to the podium.
Thank you, Altaf, and good morning, everyone. In fact, Altaf, thank you so much for reminding me. One of the first files I ever got when I became mayor in 2010 was the hospital file. And one of the great challenges back in the day was that, as far as I was concerned, there was far too many people who didn't believe that one day we would get a hospital. And really, is it with an attitude of gratitude that I say these words this morning, because I think they speak not only to the facts and figures and statistics that have been cited by earlier speakers, but also by the incredible power that hope and optimism can generate in a community. Building a hospital is truly a labor of love. It doesn't happen on its own. It requires 24-hour attention, 7 days a week, 365 days of the year, 366 in a leap year, of course, because this is a monumental task. And when I say that I speak with an attitude of gratitude, is because everywhere I look, whether I'm looking at you, Deputy Premier, ministers, and I express my gratitude to government, whether it's Foundation Board, whether it's the building itself. I remember driving by here and just seeing how the building was evolving, and as the building evolved, you began to also gain in that momentum that is required to bring people on board to continue to believe in the dream of a hospital. Imagine that for a long, long time, the city of Vaughan was one of the very few cities in the entire country that didn't have a hospital. And people were extremely patient here in the city, but then when the announcement was made that finally we would begin to build this hospital, I could see that even those who didn't believe it would happen became believers. And there's nothing more important in life than conversion to the values that I think speak to the incredible capacity of humanity to come together when we share in a common vision and a purpose to move forward together to achieve those goals that essentially improve the human condition. And really, public life, as we all know, is all about that. How do you improve the quality of life for people? How do you provide hope? How do you remain rooted in hope and optimism during challenging times? And so this journey in Altaf, we have probably lived through it. These lands were very interesting lands when we first started. We had all sorts of things to settle. But slowly but surely, through always reminding oneself that ultimately the goal is to build a hospital. The goal is to provide excellent quality of care here in this hospital. The goal is to provide better quality of life for the citizens of Vaughan. And so as I often do, as I contemplate and meditate upon the meaning of this hospital, I'm often struck by how positive energy can, in fact, come together to create something that is as special as this. These walls will talk one day. There'll be many experiences here. There will be the first child born in this hospital. There will be a sense of community that will evolve. And so when I think of all the individuals that have been involved, whether you're talking about the construction workers, whether you're talking about the nurses and doctors, administration and government, let's just remind ourselves that at the end of the day, when we plant good seeds, we will bear good fruits. And this hospital is an example of that. Yesterday I was talking actually to the Premier and told him that I would be here to celebrate the substantial completion of this hospital. And he was also overjoyed by the fact that we are in fact at this phase of the formation of this wonderful living organism, which is this hospital. I also want to express, of course, my gratitude to the individuals who have been so supportive of the campaign for $250 million. $178 million have been raised. When we started raising that very first dollar, $250 million looks so far away. But what happens? People come together, they understand the importance of the hospital, they understand the fact that when we as individuals have blessings bestowed upon us, we must share them. And many, many people have demonstrated that sense of responsibility to come forward, and not just individuals who have been blessed with incredible wealth, but it's also little community organizations who give of themselves, who have fundraisers to give back to the community, express themselves in different ways. And I will tell you, as chair of this campaign, I appreciate the person that gives us 50 cents and the person that gives us 40 million equally, because it all expression, it is their expression of giving. And there's nothing more important in life than to give of oneself in a very selfless way to bring about positive change to people's lives. Thank you so much.
Thank you so much, Mayor Bevilacqua. I want to thank a few people. Obviously, it's been an interesting ride to get to this place. The effort of our staff, of our physicians, of our volunteers has just been incredible. Their ability to just take on more and their capacity to just do what's right has been awe-inspiring. If you really think about what we've had to do over the last decade or so, we've been running one of the busiest hospitals in the GTA. We've been designing and getting ready to open a second site, almost double the size of what we run today. And in the middle of that, we obviously had this global pandemic. And not once did anybody say, I can't do more. Whether it was that frontline nurse in the ICU, whether it was that physician in the ED, whether it was that EVS member cleaning a space, everybody wanted to do more. And now watching some of those staff enter this facility, their pride, their inspiration to give more to this community is just amazing to see. So what you have with Mackenzie Health is a passion, and that passion starts with the board, and it goes right down to that frontline provider, because they believe in healthcare, they believe in this community, they believe in going above and beyond. And that's what it takes. So I have been so proud to lead this organization. I've been so proud of their capacity to just do more. So I can assure all of you in the room that this hospital will open successfully, it will meet the needs of this community, and it will be here for generations to come. Now, at substantial completion, events like this, it's customary to do a ceremonial handover of the keys to the building. So I'd like to invite our partners from Project Co. I think Angela and Kelly, if you can come up, along with Mark Falbo to the podium, and we'll take a quick photo. And as a reminder, we'll be taking some additional photos following the conclusion of the live stream. So we'll take our first photo, and then we'll do some more photo ops, and I'll say a few more words then. So this concludes the formal part of our session. We will end the live stream. We'll take a few more photos so staff will direct others to their designated spots for the photo. But we do look forward to the early part of 2021 when we will open the doors to the new Cortellucci Vaughan Hospital. We thank you, all of you, for your ongoing support and your continued support as we open the doors to this amazing facility. The countdown is on as we get ready to open this amazing facility for this community and double our access to care in this region. So thank you all, and be safe.